Forbes magazine named them the best healthcare system employer in the state of Alabama. So we're discussing working for Infirmary Health System. This is Lifecast, a podcast from Infirmary Health System. Thanks for listening. I'm Joey Waller. Our guest, Ivy Singley. She's Manager of Employment Services for Infirmary Health. Ivy, thanks for joining us.
Yeah, thank you for having me.
So first, congratulations on being recognized by Forbes. And so, in a nutshell, we'll get into more specifics, of course, in a moment, but what do you think makes working for Infirmary Health so unique and positive that led to that status from Forbes?
I think it has a lot to do with all the great things that Infirmary Health does for our employees. We do a great job at making sure staff have the latest and greatest in equipment to do their jobs. We always conduct annual employment engagement surveys to get their feedback because it's so important to get their feedback and what they're interested in and what their needs are. We do a great job at implementing what they tell us and give it back to the employees and provide the most competitive benefits in our area. And I think that means a lot to the workforce today. That just shows that they are valued and that we value their suggestions.
Well, that sounds like a great idea, employee surveys. And other than that, as you well know, part of being a great employer is creating a positive work environment. So nowadays, besides those surveys, how do you do that?
Well, I think what you have to do is you've got to cultivate it from the top down. You know, when you employ people to become the management or the leadership of the infirmary, it's about adopting our core values. We have something that's called LIFE, and it stands for leadership, integrity, family, and excellent service. So when people from the management adopt those ideas and they practice them every day, then you want to hire employees that are going to have the same belief system and the same core values. So I think a lot of that goes into it and fostering that type of environment, no matter what facility or area that you work in inside Infirmary Health.
Well, Ivy, I don't know if you're a big sports fan or not, but in sports nowadays, we hear so much about culture, about teams and organizations trying to build a quote-unquote culture to buy into the same belief system. And it sounds from what you just said like Infirmary Health tries to do exactly that with their employees, right?
That is correct. We establish the core values. We make sure that employees understand that when they come through orientation. And it's just our belief system. That's how we do our performance evaluations. That's the belief system that we live out. We make sure all of our employees understand that and know the meaning of each letter so that way we have that culture at all facilities. And no matter where you work inside Infirmary Health, we all have the same core values.
Indeed. So becoming a doctor or nurse naturally involves such commitment and so much hard work. Can you discuss Infirmary Health System's residency programs for both doctor and nurses?
Well, for the doctors, it is a newer program. We probably are in our third year of this. It is something that is sponsored by Thomas Hospital, which is one of our campuses, one of our hospitals. And doctors do the matching process where they're matched up from their colleges to our facility. And then they come here for about a 3 to 4 year program where they can do their residency and really learn about the type of specialties that they're interested in. They have a clinic that they operate out of, and that way they can learn and finish up their medical degrees with us. When it comes to the nursing program and the nursing residency, basically what happens is a nurse graduates from college, and then they have this continuum type of education that we do, and we call it the nurse residency. And they come out, and it's for about almost a year, but it's really a 12-week-long process where they go a little bit deeper into what are the fundamentals about being a nurse, what are the true skills. And we try to hone in on that for them and introduce them to the other parts of the hospital where they can round and learn not just about nursing, but maybe about respiratory, about pharmacy, and learn how those other departments work alongside with nursing. So the residency program has been very successful. We've done it for the last 5 years. And nurses love coming in there because it just gives them a deeper dive into the field that they have chosen.
Now, that being said, you also, of course, employ many clinicians and other staff. Those of us that have either been in the hospital or visited someone there, we know that often it's the people, quote unquote, behind the scenes or in the trenches that often make or break someone's stay and experience. So what should people know about working for you in some of those other positions?
Yeah, so many times people think that working in the hospital or the healthcare setting, it just requires being a doctor or a nurse. But there are so many positions like myself. If you've got human resources, you have accounting, you have marketing, then you've got radiology and pharmacy. And so many times those are the other departments that make the hospital work as well alongside with nursing. And so I think here at Infirmary Health, we foster a great environment of showing each person, whether they be what we call non-clinical or clinical, their roles and how important they are in patient care at the end of the day.
Working just about anywhere, it seems, comes with its share of stresses. But needless to say, healthcare comes with its own level of stress, because oftentimes you're talking about life-changing, life-threatening situations. It could be life or death. And so with mental health care, Ivy, nowadays getting so much more attention, and rightfully so, what's offered by Infirmary Health Care for their employees when it comes to keeping of a right mind and dealing with those stress levels when they pop up?
Well, we have a number of different outlets. We do have something we call our EAP program. It's our Employee Assistance Program. So for the stressors, whether they be on-the-job stressors or just life in general, we have the ability for our employees to call our EAP program to go talk to a mental health professional about whatever it is that they have going on in their life. One of the things that we also brought on during COVID time, was what we call lavender rooms. And they're at all of our facilities. And the lavender room is just a place for the healthcare professional or the non-clinical person to just kind of retreat to. It's got lazy boy chairs in there. It's got a nice atmosphere. It's got books that they can look at and things that they can just kind of reflect on. And it's just a time for them to take a time out and just get away from the situation and kind of go into that room and kind of calm down and just get all their rathers back about them, right? And so we offer both of those processes to be able to help employees from a mental health standpoint.
That sounds great. I think I'd be a huge lavender guy if I were working for you all.
Exactly.
Right? Anyone can use a little bit of lavender room these days at work, I think. How about this? In this pandemic age, it seems never have employee health benefits been more important to people. So can you summarize for us, please, Infirmary Health System's benefits package?
Yeah, absolutely. We offer the Blue Cross Blue Shield, our Viva Healthcare. So we have two healthcare options, health insurance options, and we have a 401k plan for their retirement. We also offer short-term and long-term disability benefits. We have an all-inclusive ETO plan for them. We offer tuition reimbursement, which is a big deal these days. We also have an employee pharmacy, and we also have an employee health clinic where we have a nurse practitioner. So if our employees get sick and they don't really have time to go to the doctor or don't need to take off, they can go to the clinic and be seen by a nurse practitioner, and then they can have all their prescriptions filled here on the campus or their respective campus where they work. So altogether, our benefit package is very good. It's one of the best in our area.
A couple of other things. I want to circle back to something you mentioned earlier, which was giving surveys to employees for important feedback from them. Anything in particular, be it positive or perhaps negative, that came up on those surveys that resulted in change or resulted in something happening on the management end that led to a better place to work for everybody?
Yeah, I would tell you that in those surveys, all the times when we run them as employers, you might not ever know what you could get back in those surveys, but our employees tend to be very transparent, which is great. We get a lot of positive feedback, and we do get some of the negative feedback. One of the examples maybe of a negative feedback, it might be that we need more blood pressure cuffs, or we might need, one of the things that they said was that, instead of handing out turkeys at Christmas, can we hand them out now at Thanksgiving? So it's not that it's negative necessarily, it's just a thought by an employee, and that gives them a platform to be able to share with us as management that, hey, we like those opportunities, but could we do it better this way? Or could we do it better that way? So in it all, we've gotten a lot of positive stuff, which just reinforced what we thought we were doing correctly for them. But then there's also the negative feedback. And sometimes that's where we enhance our benefit packages. Sometimes it's equipment-related situations. Sometimes it's just the environment, like, hey, can we add better lighting, or can we buy more beds that do different things? So I would tell you those employee engagement surveys have been great for Infirmary Health.
It sounds like just having that line of communication open between employer and employee is important to people to know that they're being heard and they have that option, right?
Oh, absolutely. They love that platform, and we love being able to provide that for them.
Of course, the internet and social media are now major tools for employer recruitment. How does Infirmary Health System use that to connect with potential employees in this modern age of technology?
Yeah, you are so right. That social media platform is very important these days. I would tell you that our marketing department does a great job in managing all of our social media platforms for us. But, that is the way of technology now. That is the way of communicating, especially with these newer generations. So I would tell you, Infirmary Health, we make sure that we're on all social media platforms. We make sure that we monitor those and we advertise our jobs out there and try to hit all the different generations and all the different platforms that people may be looking for a job these days. So you're liable to look on Twitter or Instagram or any of those, and you'll find Infirmary Health for sure.
And then finally, let me ask you about your own experience working there. How long have you been with the company?
I have almost been with Infirmary Health around 15 years.
Okay. And what would you say is your favorite part about your position or working for Infirmary Health in general?
I would tell you that my favorite part is being able, especially in the line of work that I do, is being able to assist our current employees with finding new opportunities and jobs and career paths. But then at the same time, it's also for that new hire that may have never been able to get a job yet, and now we're giving them a job for the very first time. So it sets them on their career path. And one of my favorite things at Infirmary Health is the way that they are so transparent. Our leadership goes to bat for our employees at all times, and they make it a great place to work. It's very transparent. They're open to new ideas. And I think that's what makes Infirmary Health works so well, and I think that's what provides all the longevity that we have in our employees, and it just creates our culture.
And obviously something that, as we said at the outset, was recognized by Forbes magazine, so you're obviously doing a great job at doing a great job, if you will, right?
Yes, thank you so much.
Sure. And for more information or to apply for a position, please call 251-435-4920. Again, 251-435-4920, or visit infirmaryhealth.org/careers. Again, that's infirmaryhealth.org/careers. Well, folks, we trust you're now more familiar with working for Infirmary Health System. Sounds like a great place to work. Ivy Singley, thanks so much again.
Yes, thank you.
Now, if you found this podcast helpful, please do share it on your social media. And thanks again for listening to Lifecast, a podcast from Infirmary Health System, hoping your health is good health. I'm Joey Wall.